Hello, wonderful viewers, and welcome to a video that's about to uncover the sweet secrets of well-being. It's time to explore the fascinating world of apitherapy. Today, we're embarking on a journey into nature's own medicine cabinet, where the hum of bees becomes a healing symphony. So grab a seat, maybe a warm cup of tea with a dollop of honey, and let's dive into the extraordinary world of apitherapy. So the first question that you may have is, what exactly is apitherapy? Apitherapy is a complementary medical practice that involves the therapeutic use of bee products including honey, bee venom, royal jelly, propolis, and bee pollen for promoting health and treating various medical conditions. This holistic approach has ancient roots with historical references to the medicinal use of bee products found in different cultures. Apitherapy is utilized in different forms such as topical applications, dietary supplements, and in some cases, controlled bee stings. The compounds found in these bee products are believed to have anti-inflammatory, antibacterial, and immune-boosting properties, contributing to their potential therapeutic effects. Ancient roots of apitherapy. Apitherapy, with its roots deeply embedded in ancient traditions, has a rich and diverse history that spans civilizations across the globe. Dating back thousands of years, historical records reveal the medicinal use of bee products in cultures as varied as ancient Egypt, China, Greece, and the Mayans. The earliest practitioners observed the remarkable health benefits associated with the consumption of honey, propolis, royal jelly, bee venom, and pollen. In traditional medicine, these substances were recognized for their anti-inflammatory, antimicrobial, and nutritional properties. Over time, the accumulated knowledge and experiences of diverse cultures contributed to the development of apitherapy, a holistic approach that harnesses the healing potential of bee products for various health conditions. Today, apitherapy continues to captivate interest and gain recognition, bridging the ancient wisdom of our ancestors with contemporary scientific understanding. Although bee venom injections have not yet gained approval from the medical establishment for treating rheumatic diseases, the application of live bee stings is frequently employed and has proven beneficial for this purpose. The typical treatment regimen involves receiving bee stings 3 times a week, spaced approximately every other day. These treatments are administered across different areas of the body in a rotating fashion, ensuring that a previously treated area is not revisited until all symptoms from prior stings have fully healed. This particular form of bee venom therapy, BVT, is widely accessible, and barring any hyperallergic reactions in the patient, it is considered safe, even with prolonged application of therapeutic doses, without causing long-term adverse effects. Use cases for BVT. While no medical intervention guarantees universal success, bee venom therapy, BVT, has exhibited efficacy across various rheumatic diseases, encompassing conditions such as gout, osteoarthritis, bursitis, tendinitis, fibromyalgia, lupus, and scleroderma. Notably, BVT's impact on rheumatoid arthritis has been extensively documented in research studies. Instances where joint deterioration has progressed to bone-to-bone contact or severe bone degradation pose challenges for BVT effectiveness. Although BVT can alleviate some pain associated with rheumatic diseases, it does not induce the growth of new bone and cartilage. While BVT's clinical value in managing chronic pain is evident, ongoing research, as of Lee's 2008 study, continues to shape our understanding of its potential. Furthermore, investigations suggest that BVT may have positive effects in cases of malignant melanoma, basal cell carcinoma, lymphoma, breast, and prostate cancer. BVT has shown promise in reducing adverse reactions to chemotherapy. BVT has demonstrated associations with increased fertility in sterile women and the resolution of miscarriages. However, caution is warranted, as there is also an elevated risk of miscarriage in newly pregnant women. Beyond rheumatic diseases and fertility concerns, bee venom has been successfully employed in the treatment of diverse conditions, including multiple sclerosis, post-herpetic neuralgia, shingles, chronic pain syndromes, eczema, psoriasis, sclerosis, corns, warts, including plantar warts, Epstein-Barr virus, EBV, Lyme disease, mononucleosis, premenstrual syndrome, menstrual cramps, irregular periods, mood swings, depression, and hypoglycemia. How BVT works. The primary goal of bee venom therapy, BVT, is to activate the body's immune system, prompting it to initiate the healing process. When the stinger penetrates the skin, it injects venom into the sting site. In response to this foreign substance, the body directs an increased blood flow to the area, concentrating the healing properties within the blood around the sting site. To ensure a complete venom dose, it is crucial to leave the stinger in the skin for a minimum of 10 to 15 minutes. During this period, the stinger acts akin to an acupuncture needle, as previously mentioned. The impact of BVT extends beyond this localized effect. Dr. Artemov from Gorky University was among the pioneers in demonstrating that venom stimulates the adrenal glands to release cortisol. Cortisol, a natural counterpart to the steroid cortisone commonly prescribed for arthritis and inflammation, is not chemically identical, and long-term cortisone use can lead to liver toxicity. It is believed that the body requires adequate B vitamins and vitamin C to produce cortisol. Hence, for optimal results, individuals seeking therapeutic bee stings are advised to consume 1,000 to 2,000 milligrams of vitamin C and a multivitamin tablet containing various B vitamins approximately 1 hour before undergoing BVT. Possible side effects. Like any form of treatment, bee venom therapy may entail anticipated side effects. While not everyone will encounter all potential side effects, the most frequent ones include the initial pain of the sting, along with swelling, redness, itching, soreness, tenderness, sensations of heat in the treatment area, and in severe instances, nausea and fever. It's crucial to emphasize that these localized reactions are generally not life-threatening. Life-threatening anaphylaxis reactions affect the entire body. Typically, the common response to a sting reaction is the intake of an antihistamine. Children's liquid antihistamines are absorbed most rapidly, providing swift relief. Zyrtec, a potent antihistamine, and Benadryl are also popular choices. However, the challenge with using antihistamines for uncomfortable reactions to BVT lies in their immune-suppressing effect. Since BVT aims to stimulate the body's immune response, immune-suppressing medications are contraindicated. A preferable alternative, in this case, is the use of the homeopathic remedy, Apis mellifica, which is a purified extract also made from whole bees, which can alleviate symptoms without suppressing the immune system. Additionally, it's advisable to abstain from alcohol during bee venom therapy, as alcohol also suppresses the immune system. While exceedingly rare, about 1% of the population is hyperallergic to honey bee venom and may experience anaphylaxis. Hence, it is prudent to always have an epinephrine injector EpiPen available during BVT sessions and to conduct a testing first if the individual has not been stung within the past 2 weeks. Although rare, there have been documented cases of death due to anaphylaxis from BVT. Here are some other products used in apitherapy that are also produced by bees. Propolis. For centuries, various cultures have harnessed the healing potential of propolis, often referred to as Russian penicillin or bee glue, for its remarkable antiseptic, antimicrobial, and detoxifying properties. Crafted by bees from resins of trees and plants, propolis serves as a protective shield inside the hive, warding off bacteria and fungi that could harm the colony. The properties of propolis vary slightly depending on the types of tree and plant resins found in different regions worldwide. Enriched with flavonoid compounds recognized for their anti-inflammatory, antioxidant, and tissue-strengthening effects, propolis has garnered attention for its potential regenerative benefits. A 1994 study in Pollen even revealed that mice given propolis lived longer than those in the control group, suggesting potential anti-aging properties attributed to its antioxidant content. In regions where antibiotics are not readily available, propolis is commonly utilized to heal wounds. Whether employed as an antiseptic wash or salve, propolis prevents bacterial growth in cuts and burns, facilitating the healing of unhealed skin lesions. As a mouthwash, it combats bad breath, gingivitis, tooth decay, and gum disease, also serving as a remedy for sore throats. Additionally, propolis exhibits anti-inflammatory properties, offering relief for conditions such as arthritis, boils, acne, asthma, dermatitis, ulcers, and inflammatory bowel diseases. Notably, propolis showcases antimutagenic effects that may contribute to cancer prevention. In combination with royal jelly, has been found to alleviate the side effects of chemotherapy and radiation therapies. Royal jelly, a milky substance produced by the hypopharyngeal and mandibular glands of nurse bees between their 5th and 15th days of life, holds a pivotal role in the development of bee larvae. During the first 3 days, all larvae receive royal jelly, after which only those designated as queens continue to be nourished with it. This exclusive diet has transformative effects, resulting in queens that are larger, more fertile, and remarkably long-lived compared to worker bees, who typically live 4 to 6 weeks. The queen's extended lifespan of up to 6 years and her ability to lay 2.5 times her weight in eggs daily are attributed to the powerful impacts of royal jelly on the bee's endocrine, hormonal, and metabolic systems. China stands as the leading global producer and consumer of royal jelly, deeply integrating this substance into traditional Chinese medicine. The wide array of medical conditions addressed by royal jelly includes anxiety, arteriosclerosis, arthritis, asthma, depression, insomnia, hair loss, impotence, liver and kidney disease, stomach ulcers, menopausal symptoms, varicose veins, and skin conditions. Rich in B vitamins, royal jelly stimulates metabolism, enhancing the processing of proteins, carbohydrates, and lipids. Acting as a potent antioxidant, it reduces free radicals associated with aging and influences the adrenal glands to increase adrenaline secretion, providing potential cardioprotective effects. With its protective influence on the cardiovascular, pulmonary, and immune systems, royal jelly holds esteemed value in various cultures. When combined with other bee products, royal jelly may enhance its effects on specific conditions. Recent discoveries highlight its ability to mitigate the negative side effects of chemotherapy and radiation therapies, especially when paired with propolis. This combination also demonstrates positive effects against viral infections such as shingles and hepatitis. Though there is much to unravel about royal jelly, recent studies from Europe and Asia showcase its versatility. Japanese research indicates its anti-fatigue effects in exercising mice, while Chinese and Russian studies underscore its efficacy in treating chronic viral and bacterial infections, anorexia, varicose veins, and stomach ulcers. During a flu epidemic in Yugoslavia, regular royal jelly consumption correlated with a lower likelihood of contracting the flu. A 1995 Egyptian study revealed royal jelly's antibacterial properties, including efficacy against E. coli. With its contribution to collagen synthesis, royal jelly is increasingly found in dermatological products, and it is applied in healing from prolotherapy treatments and other injuries. Raw honey. Raw honey is rich in various plant chemicals acting as antioxidants, with some varieties boasting antioxidant levels comparable to fruits and vegetables. These antioxidants play a crucial role in shielding the body from cellular damage caused by free radicals. Free radicals implicated in the aging process and the onset of chronic diseases like cancer and heart disease are counteracted by the antioxidant compounds found in raw honey, particularly polyphenols. Research indicates that these polyphenols exhibit anti-inflammatory effects, potentially safeguarding against conditions linked to oxidative stress. Additionally, raw honey may encompass bee pollen and bee propolis, providing supplementary benefits. A 2017 review of studies suggested that raw honey could offer protective effects for the respiratory, gastrointestinal, cardiovascular, and nervous systems, and even holds potential in cancer treatment. A review of studies conducted in 2018 discovered that honey possesses antimicrobial properties. Another review from 2017 also indicated potential health benefits related to microbial inhibition and wound healing from honey, propolis, and royal jelly. It's crucial to note that the honey utilized in research settings is of medical grade, ensuring it undergoes inspection and maintains sterility. However, caution is advised when considering using store-bought honey for medical purposes, especially for treating cuts. It is always advisable to consult with your doctor before utilizing honey for any medical applications. Honey is occasionally employed in addressing digestive problems like diarrhea, although there is limited research validating its effectiveness in this regard. However, there is potential for it to serve as a treatment for Helicobacter pylori, H. pylori bacteria, a prevalent contributor to stomach ulcers. Additionally, honey includes beneficial prebiotics, supporting the nourishment of beneficial bacteria residing in the intestines. These bacteria play a pivotal role not only in digestion, but also in maintaining overall health. Bee pollen. Pollen, the male reproductive element of plants, serves as the primary dietary protein source for bees. Bees utilize pollen to create bee bread, blending it with honey or nectar and introducing enzymes to prevent germination. They also consume pollen, aiding in the secretion of royal jelly and wax. Although popular as an energy-enhancing nutritional supplement due to its approximately 25% protein content and inclusion of essential amino acids, vitamins, and minerals, excluding vitamin B12, pollen lacks the ideal nutrient proportions for prolonged human sustenance, making it perfect for bees rather than humans. Notably, pollen boasts high antioxidant activity, surpassing any fruit or vegetable according to the ORAC index. Consuming 1 to 2 teaspoons of pollen equates to a serving of vegetables, making it a valuable dietary supplement. Scientific evidence is mounting, highlighting pollen's anti-inflammatory, anti-cancer, and anti-arthritic properties. Its therapeutic applications extend to reducing symptoms in individuals with hay fever and pollen sensitivities, achieved through oral administration akin to allergist sensitization injections. Beyond allergies, pollen has been reported to offer benefits in various medical conditions, including varicose veins, high cholesterol, fatigue, infertility, impotence, anorexia, obesity, digestive issues, hypertension, prostatitis, depression, scar formation, and recovery from illness and surgery. Compatible with other therapies, suitable for long-term use, non-toxic even at high doses for non-sensitive individuals, and safe as a supplement during pregnancy, pollen emerges as a versatile and health-promoting addition to one's diet. It is easy to see what the buzz is all about with apitherapy. It should be noted that this is a form of alternative therapy, so before you start any of the therapies we talked about, you should first consult your healthcare provider. It's also important that you seek a practitioner that is well-versed in apitherapy because some of the therapies we discussed can be dangerous. I hope you enjoyed today's video and learned something new about apitherapy. If you are new to Zen Health, please remember to hit the like button on this video and the notification bell so you don't miss out on our future content. Thanks for watching our video, and we will see you next time.